Our first community conversation, we are joined by Dr. Max Hoggard, an orthopedic oncology and trauma surgeon with UVA Health. He's sitting down with her.
Dr. Hoggard, thank you so much for coming in today.
Thanks for having me. Appreciate
You're very welcome. So today we're talking about Sarcoma and Bone Cancer Awareness Month. So what exactly are sarcomas?
Yeah, so they are actually a pretty rare type of cancerous tumor. They can either come from the bone or from the soft tissues. And soft tissues being muscle, blood vessels, fat, nerves, connective tissue, things like that. Probably about 1% to 2% of all the cancers in the U.S. Each year that are diagnosed are sarcomas, so pretty rare disease. Yeah.
And is there anything people can do to reduce their risk for sarcomas?
Yeah, there's not a lot of identifiable risk factors for this type of cancer as there are many others. Prior radiation treatment for another type of cancer is a risk factor, and there's a handful of inherited genetic syndromes that can predispose you to it, but they're largely spontaneous and happen sporadically, so identifying them early is probably the key for things.
And what are the most common symptoms?
Yeah, so they typically arise in the extremities, so the arms or legs, and mainly people notice just a growing mass that's been there for some time. They're not always painful. A lot of times they're painless, and that's usually the first symptom if it's a soft tissue sarcoma. If it's a bone sarcoma, people can have bone pain or potentially a fracture that's not explained by an injury or trauma.
And then are there treatment options available at UVA Health?
Yes, there are. So we're fortunate here that we have a dedicated sarcoma treatment team, and that includes specialized sarcoma surgeons. We have adult and pediatric chemotherapy doctors that specialize in the chemotherapy portion of the treatment, if that's required. And then we also have radiation oncologists that use radiation to help treat some of these types of tumors.
Well, that's great that there's a dedicated team to that.
Yeah,
that's wonderful.
Yeah, it's something that we haven't had the full team here at UVA up until the last few years, and so I think we're excited to certainly offer that to the community and the region around here.
That's wonderful. And how can people get in touch with UVA Health if they are just want more information, or maybe they're looking for a treatment themselves?
Yeah. So I think us in the orthopedic side of things are fortunate that we're sort of paired up with the cancer center there on the medical campus. So contacting either our folks at the cancer center or us at UVA Orthopedics can get you plugged in and be seen.
Wonderful. Well, thank you so much, Dr. Hoggard. It was really great having you here today.
Yeah, thanks so much. Appreciate it.
You're very welcome. Steve?